Well, despite warnings from health officials about coronavirus possibly spiking again, 48 states will partially reopen this month. Joining us now is Alabama Senator Doug Jones. He's a member of the Senate committee that questioned the nation's top medical experts yesterday. Senator, great to see you. I want to start with the thing that we keep hearing over and over again, that part of the formula for reopening is testing, and that we need more of it. We need it to be more readily available. And what President Trump keeps touting is that the U.S. has done more testing than any other country. He says we've even done more than South Korea. He keeps holding up South Korea as this great comparison that the United States is better than. And you threw cold water on that yesterday. So let me just play that moment from the hearing.
The fact that we are a nation that has about 6 times the population of South Korea, but yet we have about 310 times the number of deaths from this pandemic. So I think we have to be very careful in making comparisons around the world, comparing the United States to other countries.
Okay, Senator. Now, about 3 hours after you said that, the White House press secretary came out and touted how the U.S. has done more testing than South Korea. So I'm not sure your message is getting through to the White House. What do you think they don't understand about testing?
Well, I think that they just don't want to get it. I think they want things opened up quickly because the economy is continuing to tank, and that is a centerpiece of President Trump's reelection bid. But if you listen to what Dr. Fauci said, Dr. Redfield said, what Dr. Hahn said, they recognize that we are inadequate in testing, that we need more testing, and it's important to remember that it is not just testing. Dr. Fauci yesterday talked about the spikes in community spread and the need for more testing, but he also talked about following the data from that testing, more contact tracing. That is incredibly important. And quarantining. That's why South Korea's numbers are down. As Senator Romney said, they were very aggressive in their testing and quarantining early on. And if we're going to open back up, we need to do the same thing for the next community spread that we are likely to see in the fall.
I'm not sure we're capable of that. And the reason that I say that is because of what Dr. Redfield said yesterday. He was very candid during that hearing, and he admitted that it got away from them. They did have a system of contact tracing, and then it overwhelmed the system. And I'm not sure that today we're in a different situation.
No, I think we are in a much different situation. This hit us very, very quickly. We understand that now. You look back at the timeline of January and February when alarm bells were starting to sound, but it was not until March that all of a sudden things just collapsed. And I think we're in a much better position now to see how this virus is spread. What we've got incredible research going on about testing. We've got research going on about vaccines. We should learn the lessons from the past, and I think that we're in a much better position. But the key is that we've got to start ramping that up now. We don't have time to wait. There is a sense of urgency, despite what Senator McConnell said about this next stimulus package. There is a hell of a sense of an urgency with regard to testing, contact tracing, and making sure that we have a quarantine plan in place for when we do see these spikes.
No, for sure. Listen, let me be clear. Yes, we've learned a lot. Yes, we have our arms more around this than we did back in February. But in terms of contact tracing, just contact tracing, are you saying that you think that the federal government and or state governments are capable of doing the level of contact tracing that we will need?
They are capable. Are they capable at this very moment? Absolutely not. We've got to get more money to them. We've got to figure out this plan. Dr. Redfield testified yesterday that he's working with the states. I believe that. I think that the state, I know in my state, they're looking at trying to ramp up all this. We are not capable of doing that at this very moment. But I think we've got the time. We've got the opportunities to do that. We've got to get more money. We've got to get a plan. Those plans are being developed, but they need to put that urgency on those plans. I think by this summer, I think we can do that. You know, look, we've got the opportunities to learn from these lessons. We've got to seize those opportunities, or as Dr. Fauci said, there's going to be more needless suffering and more needless deaths.
Very quickly, I want to look at what's happening in your state of Alabama. So according to Johns Hopkins, the trajectory is still going up. Your state is opening, for the most part, I guess, on May 22nd in terms of businesses and gatherings. But the bar graph, if you look at it, the numbers, I mean, you know, the red line shows that the trajectory since April 30th has gone in the wrong direction. Are you nervous about what's happening in Alabama?
Yes. Absolutely. I think that the governor has done a pretty good job of trying to thread that needle. She has got a lot of pressure. Every state around us is trying to open back up. People are getting antsy. They want to get out. They want to do some things. But even the governor in her press conference the other day stressed the need to do the social distancing, stressed the need to wear a mask. I think part of this is going to depend on not just the opening, but it's going to depend on the American public. Look, we're in what is amounting to moving into a post 9/11 world where we need to wear the mask. We need to do the social distancing. If we can do those things and open up slowly and work with folks, I think people will have more confidence, but they need to do the social distancing. They need to wear those masks. That's a message that's getting lost as well. People, and I think right now they're so anxious to get out. They're listening to the messages about opening, and they're not listening as much to the messages about what you need to do to protect your health and your neighbor's health. If we can do that, we're going to keep the numbers down.
Would you like to see the president and vice president wear masks at all times?
Absolutely. I mean, you look around the Senate when most of the people, now I will tell you, I was waiting to get on the subway yesterday and a group of Republican senators got off. Not a single one of them or their staffs were wearing masks. I think that sends a wrong message. I would like to see the administration, the president, the vice president, whenever they are out, they need to be wearing a mask. I think part of what we do as public officials is to set an example. And I think we have to set an example. I've been trying to do that in my home state for the last 6 weeks or 7 weeks. Set an example. Try to tell people it's okay. It's not a cultural shock to wear a mask out in public these days, because I want to protect your health and I want you to protect mine.
I want to ask you about the Ahmaud Arbery case out of Georgia. They are asking for the DOJ, the U.S. DOJ, to get involved with this. Do you think that the DOJ should and will?
I think they should. I think they have started to look at this. I believe that clearly there is evidence that this is a potential hate crime. There is jurisdiction there to do that. But I think there's real questions about why this didn't get pursued early on. Obviously, those that were arrested have some contacts with law enforcement. And I think that needs to be examined very, very closely. What happened to that young man was just unbelievably wrong. It was a tragedy. We've got to do better. We cannot wait 2 months and for a video to come out that essentially shames the state and local authorities into taking action. This needed to be done early, and I think it would be appropriate for the department, the Civil Rights Division, and others to take a good look of not just the crime itself, but what happened in the aftermath of the crime and why it took 2 months to make those arrests.
Senator Doug Jones, great to talk to you. Thank you very much for your time.
As always, thank you for having me.